is try to catch up, but it's not a possible. I think this is one example that we need to take, not only according to we consider the administrative situation, the state, the border, and everything like that, but the disease don't take into account this kind of situation, and the livestock keeper sell the animal where it's good to sell and is not considered the border. And we need to take this approach and the ecosystem approach concerning the disease. Thank you.
Thank you very much, Jean-Marc. So when we are in Nigeria, when you are getting to the steps of doing this evidence-based approach of getting the information for the risk of occurrence, it's best if it's done with this ecosystem approach to have like exchange of information between the countries that are linked to each other, notably the Lake Chad region. So you have information about mobility of animals and the seasons of animal mobility at the border, so that it's taken into account when you build your strategy as well. So it's something to take in mind, not only building your own strategy, evidence-based strategy on your side, but really in coordination with other countries if possible. It will be the way to be very efficient. It's not easy, but definitely it's a way to move forward. Any other question or comment at this stage? So if you wanted to say something, yes?
Oh, this is what. Okay. Yeah, just to contribute. When we were looking at designing the strategy for PPR control in Africa, we looked at other things, all reasons, programs, and other conditions in Africa. First, there are countries that have taken a World Bank loan, as you said, under PRAPS, that are controlling PPR. Those ones are doing a good job. There are countries supported by ECOWAS to control epizones. That program is also taken up very well. There are yet other countries that are individually supporting all neighboring countries. For example, Senegal. Senegal procured vaccines and gave to all their surrounding neighbors to vaccinate so that they don't bring PPR into their country. And since they produce the vaccines, they engage on a mass vaccination. In fact, I was there at the flag off of that mass vaccination. So those regional activities meant that PPR was being continually controlled in little sections in the country. So when we were designing the strategy, we said, okay, what do we do now that these programs are on? We said, okay, the best thing is to look at the areas where the strategy can support. One, we will support the diagnostics systems for serosurveillance, because the next thing to do is to serosurvey and know after all these programs where this strategy can come in. Because it is supported by EU, and I also want to mention that in East Africa, the Bill and Melinda Gates supported some 3-4 East African countries to control PPR. So all those programs, a lot of money has been pumped in. So we needed to do targeted vaccination to know how to mop the remaining PPR. But when we say targeted, Africa is too big a country that you cannot look at it as a small place where you do. So we talked of where do we support these countries. We support serosurveillance, that is, we strengthen the diagnostic systems across the region. We will support veterinary services, we'll strengthen them for diagnosis for all logistics support, and co. And then we will support all our vaccine production facilities. We'll give them either in terms of loan, what they will need to produce PPR vaccines. Now, what is the strategy to go in and look at what we have? Zero surveys, look at the epizones, look at all those adjoining countries. Now, coming down to Nigeria, the program has not started. It probably will start up middle of next year, in which case we will get the money from the EU to help us do that. But in the absence of that, Nigeria is now looking at its own borders. What do we do? Yesterday we were speaking, I was speaking with one leg on the ground because we said we needed evidence-based information so that I can talk with strength. Now, having seen what you presented here and the scatter there, I know that PPR is endemic. And a white country like Nigeria, you cannot start going to do targeted vaccination. Imagine what Jean-Marc said. After vaccination, the animals will disappear, some to Nigeria, some to Chad, some to Niger. The same thing here. Somebody mentioned this is a cash in hand. When you have an emergency, you just grab the animal, throw it there. When your girl sees a boyfriend somewhere and she wants to get married, you grab another one and give to them, you know. So it is difficult to keep track of this. So what do we do? For me, the best way to do is to consider mass vaccination either on state level, but it has to be coordinated. I'm glad the representative of the Chief Veterinary Officer of Nigeria is here. We can coordinate with the states. States that can unite together and do a mass vaccination, they do. If they cannot coordinate together, let individual states do. Yes, it will not be perfect. It may be 60 to 70% coverage, but that will help us. If we do this for the next 2 years, by the time this major control program comes in, then we will be able to now say, okay, let's look at the foci. Because right now, wherever you test for PPR, you cannot call it an outbreak because it's endemic. An outbreak is where you don't have a disease, and when it comes up, then you test and say, oh, there is a problem. But here, there is no problem. The only problem is that it has surfaced beyond where it's supposed to be at the ground, you know. So if we go by that, we do mass vaccinations, and then after some time, we go for the targeted vaccination based on the evidence that, look, we have mopped up this place. And in any case, when we do mass vaccination, doing it once will not take care of the problem. The animals are very, very mobile, and they reproduce very rapidly. So in the span of 2 years, one will be going to get one young doe would have given birth 3 times. So if you don't keep track of it, the young ones who are not protected would have gone very far from that place. So for me, we can go on the targeted vaccination, mass vaccination, then later go on the targeted vaccination. And one thing we should also note, in Africa, we have different conditions. What we have in Nigeria may not be what we have in the next country, Benin. Benin, I must tell you, the system is a bit different from Nigeria. Here, once you are a vet, you can go and vaccinate anywhere. In Benin, it is not so. In Benin, there are certain diseases that a private vet cannot vaccinate. PPR, CBPP are all public goods, they call them. A private vet cannot vaccinate. So only government veterinarians vaccinate. And if you do, they will arrest you. They have so much control. So in such cases, you understand why if you do mass vaccination in Benin, it's likely to succeed more, because when you use the state machinery, there will be documentation. You will know exactly what is there. But here, if we do on our own, the farmer is at leisure whether to vaccinate or not. He can decide if he has 1,000 animals, give a little bribe to a private vet and say, look, I have vaccinated, allow me to go. And that is all. So we will have little problems at the beginning, but once we take off, it is going to, everybody will key in. And in about 3 years, you see everybody singing the same song. We're eradicating PPR. And then, once we come up with this zero surveillance, it will show us where to concentrate our vaccinations, and then we'll do. Just my contribution.
I think we can bring the discussion back to two things. First, I think there is some confusion around what mass vaccination means. What is the meaning of mass vaccination? I think we need to get that definition right. What do we mean? And what do we mean when we say universal coverage? What percentage? Is 70, 80, 90%? And how do we do it? So what would be important for us here now is for Nigeria, where should we start from? It's action that we need to look at. Yes, eventually I know that the ECOWAS might have to come in to look at a broader regional control. However, Simon has mentioned something about the stages and that we can jump depending on where we are. So what I would like us to do is to concentrate the discussion on where is Nigeria now? What is the meaning of mass vaccination? How should we start so that we can advise the ministry on what needs to be done first before we move on?
Well, when we went for the launch in Cote d'Ivoire in 2015, at the discussions that followed based on the ECOWAS meetings of states, the representative of CVON then said, look, Nigeria is on stage 1. Well, but since that was a government stand, nobody could go against that. But PPR was first reported in Nigeria. There are so many studies on ground already. I guess the first thing we should have done after coming back was to have commissioned a dex review study. How many research work has been done on PPR? What is the distribution of zero surveillance across the country? And then you can now say, okay, look, we have PPR covered around this country. We can declare that. And what are we doing in terms of vaccination? So my thinking then was that we couldn't have said we are on stage 1, and that means we didn't know anything about PPR in Nigeria, which was not right. So my thinking has always been that let the CVON, have a meeting so that we can have an agreement that, look, we can undertake a process that can lead us to, we can say now we are in phase 2. And Simon has told us that, look, all you need to do is get the people who have been trained on PMAT and look at all the data you have on ground. Enter it into all the forms that are used for PMAT. And he said that if you look at it, we have done some genetic analysis, which was supposed to be even in stage 4 or stage something when you are doing the final evaluation of what you are doing. So we put in all the data there, and then they agree and say, okay, we are in phase 2 because we are doing a lot of vaccination. So that is a control stage. Phase 2 is control stage, and we are doing a lot of vaccination and then monitoring, surveillance too. So for me, I think all we need to do is to do what is required formally to say we are in stage 2. Okay? But I also want to ask my brother from Cameroon. You know, there was a time we had a meeting. The FAO convened a meeting on Lake Chad epizone. Is there any funding now for the Lake Chad epizone, Nick? I don't know. Is there any funding now? Because if the Lake Chad epizone, there's funding for it, then that means some of the coverage should have, then that means some of the coverage of vaccination for Lake Chad epizone should have covered part of Nigeria, at least maybe some states that are less secure, less security challenge. But so that is my take, that I think Nigeria can do something to move officially to stage 2. Okay.
Did you want to add something about the Lake Chad?
Yeah. Yeah, just a quick one to mention about Lake Chad ecosystem. I don't know whether it's early this year or last year, we had a meeting of ecosystem. Actually, it was the first official meeting of ecosystem, which now, previously, I think in 2022, there was Lake Chad Epizone meeting, but now we had now the official ecosystem meeting, covering the same topic, but now from the new perspective of ecosystem. So, and we had a team actually from Nigeria, which came in, and ECOWAS was there, and that's where we inaugurated even the guideline for ecosystem delineation for the whole PPL work which we are going to do globally. So I think there's some work going on. So probably we need to follow up with some of the officials who went there so that we can keep, and I think in the next meeting of, we are going to have probably next year, that's when we might be able to discuss more on this. Thank you.
I think
Get the CVON to convene a meeting and then get all the data put into the PMAT form so that we're sure that what stage we are in. And then the next stage is to look at mass vaccination. That's the suggestion before we, sometime in the future, look at targeted vaccination. I hope someone is taking notes.
yes, I think I would like to move to concrete associated with some Lididki recommendations, things that here a lot of people want to hear also, like things for the field, for where they are. And first one I have in mind now, because I think it's not something so complicated to do, is to centralize all the information about the resources available. It seems that it was a mission. How many veterinarians are there? How many community animal health workers? Where are there? How many vaccines? Where are there? Really having a roundup of really what are your resources for the moment and your expectation of the resources, because you hope to improve vaccine production as well and in VRI. So really, based on that, you will need this information to start having your strategies about mass vaccination. This is kind of a first step to know where you are, see if you have gaps in your infrastructure, in your resources. And this is really just a question of collecting the information from everywhere and put them in a centralized, in one place. Any comment on that one? A short comment so that we don't...
Thank you so much, Arnold. Mine is a very short but perhaps very important component of this control strategy. For some time, part of the questions we have had to deal with borders on the animal population. Is it possible that amongst the strategic steps that we are looking at to do a proper animal census, let's even have the real data for Nigeria now, so it can guide and inform the decisions we are making around control strategies? Animal census. I think the colleague from Cameroon was mentioning that at the beginning of the work that they did, they were able to get the proper animal census data that helped them also to be able to say this is what they're able to do. So can we do that? Thank you.
Okay, thank you. Before the launching of the vaccination, it's not the proper census like the statistic. We have in our system at the local level, because it's a centralized system, it's not a federal, we have more than almost 1,000 vet service at local level for all the country. And we managed to have this kind of census of livestock keeper, and we just ask to this livestock keeper how many animals they have, and we populate all this data. But it's very important because it's close to the calculation, to the census of the population and the total growth and everything like that. And one thing that I see this morning, for example, is the spatial risk analysis that we done in the pilot phase. It's possible based on the desk review and based also of the data that we have, because you have a lot of vet school, vet of data, a lot of data concerning the seroprevalence of the disease and around the country. It's possible based on this and based also for the knowledge of the knowledge of expert to expand this map to all the country. And when you have this a spatial a multi-criteria and you populate the risk analysis around the country, and you also have a census or the number of animals that you have, and you have a lab we produce the vaccine. And I think based on the animal worker, based on the fact that the vet service at the government state can centralize and harmonize the activity in the field, it's possible to begin to make sure that we collect all the data. And one thing which is very important, take advantage to Cameroon, is now to make sure that you have a good a follow-up unit concerning all the data. And you can drive this data. When you have a desk review, you can take the advantage of the fact that you have the vet school orientate the study for the student to make sure that we align to the plan at a national level. And before go to the huge money, you can take this advantage to do something. Thank you.
That's quite a interesting concrete step to take, is to, based on the information you already have in Nigeria, try to extrapolate, see if it's enough to extrapolate to across all Nigeria, or if you need to do some more of this risk-based risk map analysis in different states, maybe collecting information about animal mobility because it's one of the central information. If you have this information for, I don't know, a percentage of the states, is it enough to extrapolate the information for the whole Nigeria, giving you enough information to see where you have to start your mass strategies, your mass vaccination, where in which region it should start, because you know that most of the small ruminants are moving from that place to the rest, so you better start there and then move following the patterns you see in your analysis. Here, I don't know if there are some epidemiology experts.
From yesterday's presentation about the issue of PPR from one state, and being able to trace it to 31 other states. So I think already from this project, without necessarily going any further, there is something for us to start with, because there are 36 states in Nigeria. If you can already trace a market, an international, that Guarozo used to be referred to as an international cattle market, where a lot of animals go there, and you are able to do this, the mobility work that has been done. So that should be a basis for us to speak with the Ministry of Agriculture to start looking at a control program and mapping out where the vaccinations should be without necessarily doing any additional work.
But at least, because for the moment the risk map produced with Lididki is only for the 3 states. I mean, of course, with the mobility data we see the link with 31 other states, but we don't have yet a map for across Nigeria of risk of occurrence. So yeah, there's a need here as a concrete step to continue and adding. Of course, as we were saying yesterday, your risk map is as good as the data you put in. So you have a risk that is giving you also some misleading information. So you want to be as much as possible sure of what's the map. The map is as accurate as possible to say, okay, this we can go this way. But you have always to have in mind that you want to keep on adding more data. It's something we have to keep in mind. But as a concrete step, I would say you need to build a risk map of occurrence across Nigeria, and I would say best to add some more animal mobility surveys. I don't know from how many additional states, because we have only 3 states in the north. If you have some from other regions that you know already have a different trade network, or they are more linked with other countries, adding those to be sure that you have a first vision that's accurate would be quite important. That's what I believe, but I don't know if...
The 3 states represent 3, I don't like using geopolitical, but they represent 3 different regions. Bauchi State is, Plateau State is not central. So if there is an event in Plateau State, it means it can affect part of Benue and Kwara, and which state again, and Niger. Okay, and then you also have Bauchi. Bauchi is part of Northeast. Kano is part of Northwest. Okay, so this, if any event in any of those states can affect the rest of the zone. The only thing that is lacking is information from the southwest, southeast, and maybe south-south. Okay, but if you can, for those 3 states, you can extrapolate it to the other states within those 3 zones.
That would be good to add information from the different zones to try to have a more complete view here. You wanted to, yes, add something.
Good afternoon, all. I double as the DEX officer for animal mobility study in the ministry, being the FMD focal person. So in the last 2 years, we conducted animal mobility study along the northwest transhuman routes of Nigeria, starting from Ilela border, Sokoto State to Niger State, Jeba, to Oyo State. Then we also conducted the same animal mobility study for FMD now, for the North Central Transhuman routes, covering Jigawa, Megateri International Cattle Market, border with Jigawa and Niger Republic, through Kano, through Kaduna, Nasarawa State to Makodi. Then a northeast transhumans animal mobility study. Because of the insecurity around Borno State, we went somewhere around Mobi International Cattle Market. We went through Adamawa to Jalingo, to Enugu, and we terminated at Obudu Cattle Ranch, Cross River State. So we have the data for the mobility maps for the cattle. We have for the northwest. We have, but while doing the north central, we went a step further to collect data for small ruminants, to look at what the PPR picture looks like, because most of these Fulanis, they travel with not only cattle but small ruminants along. So that result we are still waiting to see how the picture looks like. But the mobility map is there for animals moving. Most of these animals, if you look at Nigerian border from Sokoto State to somewhere around Borno State, the distance of that border is about 1,400 kilometers. Sokoto to Borno State. And the interesting thing is that every 1 kilometer, there's a porous border. Animals are just moving in, move out. Where I mentioned the Ilela, the Maigatari, and the Mubi, they are the official routes for animals to move. But look at the illegal routes that animals are moving. And most of these animals are not vaccinated. So I'm thinking maybe as we look at the second phase, instead of concentrating on mass vaccination of animals, let's look at how we can concentrate along the borders and stop those unvaccinated animals moving into the country. We can still continue our vaccination in country, but allowing such number of animals moving will not really help us. That is one thing I'm thinking, strengthening vaccination along the country borders. Then, as we continue, even in the second phase, I have observed that there are so many development partners that are into control of PPR and Newcastle disease in the country. Red Cross is doing it. Catholic Relief Service is doing PPR and Newcastle disease control vaccination. I don't know whether Propcon is still doing it through their community animal health workers. They are also doing it. Now Lididki project is also doing it. So there is a lot of duplication. And I'm sorry to say it, resources have been wasted along? But we can, as we look into the second phase, we can come together maybe under the CVN and see how we can work and within the little resources make great impact on the control of PPR and Newcastle disease. I had mentioned earlier that as a country we don't have a policy strategy document for the control of Newcastle. So many partners are vaccinating against Newcastle, yet the country does not have a policy document. The policy document is supposed to guide and direct. Whoever a development partner that is supposed to come is supposed to key in. This PPR strategy document is there. That was why when the Lididki came, I think that document was made available to them, and they keyed in. So let's see how the ministry will come out with this Newcastle disease policy document next year, and see how we can come in, even as we try to meet all partners to minimize waste of resources in our control efforts. Thank you.
Thank you very much. So 2 points here from your comments about vaccination at the borders and the fact that there are many different events associated with vaccination. Here with Lididki, we didn't do vaccination, or only just for activation of cows. What we want to show is we have to stop doing this random vaccination, actually, as you say. And with all these NGOs, all these different state or different actions to do vaccinations, they should be under the lead at the federal level for an harmonized, a synchronized strategy. And that's where we come in to propose this strategy to all these actors that are doing vaccination. So that here, that's things I'm proposing and I'm discussing here on top of my head is you have an overview on all these activities with a strategy in mind, saying no, I mean here you have to we have to focus the resources there because from our information about animal mobility or any other data, we have to first do it here because then there's no important it won't change anything. And notably at the borders, that's also the question of if you do it only on the one side of the border, it doesn't help either. So if you want to do it at your border, you have to do it in synchronized way with your neighbor, and that's where you get in the ecosystem approach that is advised by WA. So if from the risk occurrence and mobility data, we see that there's a lot of movement at some stage, and those are at the source of a lot of PPR in other regions, well, then it's okay. It makes sense to start in this border region in harmony, in synchronized way with your neighbors, and from there move along. That would be, for me, like a logical step here. Any other comments?
I think I've mentioned it before because during one of the continuing education, when I was asked to make a presentation on PPR, I specifically looked for the intervention of NGOs in other countries. And MSF was very key in the control and eradication of PPR in Ethiopia. So it is for the CVON to document all the NGOs working on the field and demand for quarterly reports from them. It's not a waste of money, sir. All you need to do is to document and get your reports. From those reports, you can key them in. Even in East Africa, there was one of the countries, either in Tanzania or Uganda, one of the NGOs was also part of the control. So they gather information from those NGOs and make sure they input it into their national system. So the first thing is maybe another recommendation is for the CVON to document all NGOs that are working on the field as far as livestock interventions are controlled and get reports.
NADIS is not working. The website is not working. So where will people have the information? Where to deposit the information? You know I understand, sir. I understand, sir. The documentation needs to start from somewhere. There needs to be a database. There needs to be somewhere where you drop it. And when you hear comments like it is a waste of money, no, sir. I take exception. We did not. No, let me correct a notion because this is a public space. There was no mass vaccination associated with the Lididki project. The ministry needs to ask for proper information for what we're doing. And like he said, the ministry needs to take a lead to document these things. But when you come to a public space and you say people are wasting resources, it actually speaks to the fact that there is no leadership. But there should be a leadership. Yesterday we were asking about NADIS. And we were told that the website is not working. Part of the Lididki project is that there is a database now that is available. We are asking, where should it be deposited? Yesterday there was a lot of discussion about where the data should be deposited. But the website for the Ministry of Agriculture is not working. What do we do with it? So it's not a waste. We take exception to working for so many years and being told that it is a waste. It is not.
I'm aware that presently there's a small problem with the NADIS, and the office of the CVON is working on it to fix it. But what I actually meant by waste, we just said that the animals are always moving. From the data we got for animal mobility, we got animals that left Burkina Faso, Mali, they are in Oyo, Sudan, Chad, Gabon, Central African Republic, at Cross River. So, and even from the presentation, from 3 states to 31 states. So, take for example, a small ruminant was vaccinated at Bauchi. It gets to Ibadan, they are doing vaccination there. They will give it a shot as PPR vaccination campaign. So that shot, to me, looks because an animal that has not been vaccinated was supposed to take that shot because it has been vaccinated at Bauchi, now is getting another shot somewhere. So that was what I actually meant by that something. So we need to coordinate. And the office of the CVO, and I think anytime from now, is bringing all partners. Sorry, I thought Lididki is also vaccinating. Sorry for that. But I am very sure Red Cross is vaccinating, Catholic Relief Services are vaccinating, and some other small NGOs. They are doing the PPR and the Newcastle disease vaccination. Sorry about the Lididki.
Yeah, of course. Saving life of animals for the sake of smallholders is never wasted anyway, but in the sake of trying to get to the control of PPR, which is the discussion here, we want to get to an efficient strategy. And for that, we need to have a synchronized strategy. I think on all this, everybody do agree. And that's why we have the recommendations from the Lididki project to get towards that.
In different contexts of different projects, we have been evaluating the vaccination strategy in different countries in West Africa. And something which arises from this analysis is that in most of the countries, the vaccination coverage is not known. And I think this is basic data information we need before moving forward very more complex strategy with targeted approach, ecosystem approach. At least I think this data about the current vaccination coverage is key. And this means that you need to have a clear census about the small ruminant population, which is clearly something which is difficult to do. I don't know when did you do the last census in Nigeria, but usually the census date from 10 or 20 years, and then we just improve each year with a small percent, but by the end we don't really know what kind of confidence we can have in the population size. And then you need to know really the number of doses that have been used in the field. And this go back to what has been discussed before. You need to map exactly the different programs and initiatives which are contributing to vaccination against BPR in Nigeria. Because you will have different programs, you will have state vaccination campaigns, you will have ICRC, you have plenty of programs who are going to make some vaccination. And so it's important for the government to really be able to map the different actors contributing to the vaccination, to be able to calculate the vaccination coverage of the population. And the second point, very important also to spare resources, is to avoid vaccinating twice or 3 times animals. So I don't know what is the situation in Nigeria, but also the importance of marking animals which has been vaccinated to be sure they are not vaccinated twice.
that's a big question, marking the animals. Guy, you wanted to add something?
Thank you. My name is Guy Ilbudo. I would like first to apologize because of my English that is, I think, so bad. I think my neighbor is much better than me. One point I would like to raise is we are doing a good job in terms of research, in terms of funding, and the question is how to integrate these findings in terms of decision making for disease control. I would like to take two examples in Burkina Faso and in Senegal based on the study we conducted. In one study, we evaluate the willingness of the farmers to vaccinate, to accept vaccination, and to pay for vaccination in Senegal. And we noticed that at the end of the study, that the first concern of the farmers was not the price of the vaccine. They are able to pay for vaccination. But what we also noticed that in Burkina, for example, and Niger, they are vaccinating for free cost. And we also know that the state does not have, don't have mass resource. We are poor countries, and we are still vaccinating for free cost. I think this is a problem in terms of the impact of research on the government decision. And I really appreciate the recommendation to have in Nigeria a team or something, a committee, a research committee to support the government, to support veterinary services in terms of disease controlling. Another example is we conducted another study in Burkina Faso to see what is the problem in terms of vaccination against Newcastle disease. We decided to not do the vaccination free cost. We just apply the usual price, and we train community vaccinators called VVV in Burkina. And in each village, we train 2 vaccinators, man and woman. And we told them, when a farmer went to vaccinate his chicken, just go. Even at the night, anytime, anywhere, just go. Do not take additional money for that. Just take the cost of vaccination we decided together. And at the end of the campaign, we vaccinated more than 100% of expected children. So that means, once again, this is not, the price of the vaccine is not a problem. Another example, we conducted a study on the cost of vaccination, not the cost of vaccine, but the cost of vaccination, taking into account all cost items, including storage, field delivery, material communication, following through the 2 circuit channel of vaccine distribution, public and private. And at the end, we noticed that the cost in the private sector was much lower than in the public sector. That could mean that the public actors are more effective in terms of vaccination against PPR. And one thing we noticed is in Burkina, the government just decided to stop private vet activities in terms of vaccination. We don't know why. Maybe they have a reason, but that is just to raise the problem of the impact of research, to not waste money, as we are saying. Thanks.
Thank you very much, Guy. So indeed, that was one of the main recommendations from the project, to set up this scientific advisory group. And if there's some concrete steps to take within the end of the year, this is one of the ones that could be taken, along as collecting the data about your resources and the level of vaccination used, etc. And we can also directly propose to the ministry the platform for centralizing data that we did create here, to see if it's a type of platform that may be integrated with NADIS or used in addition to NADIS to help with this centralization of data. I mean, we have this platform, we should directly show it to the policymaker to see if those are useful for them. And for them, I would say we have to start keeping on doing some work in the field to get more data. And among the ones we should have is more data about animal mobility in additional states, to have a wider view. For the moment, that's the ones I have in mind. And we have only 10 minutes left to see if we have other concrete steps we want to take tomorrow.
Thank you, Arnold. I think you started mentioning what I actually wanted to talk about. So the Lididki project have successfully developed a platform. All we need now, because that is the question that has been radiating in my mind, and I've been discussing with Arnold and the rest of our team on, number one, that platform is there. There is supposed to be a server. Where is the server supposed to be seated at? Number two, the platform had been developed in such a way that other applications can be integrated to link with it and then collect data from other agencies that are possibly, or organizations that are possibly collecting data from the field. Just like the EDA said, there is need to actually identify the various organizations that are involved in animal health, and then who are possibly involved one way or the other around the subject matter. And then they can, their data can be, or their system can be integrated into that platform if possible. But the major question is this: where is that server supposed to sit at? And who is supposed to manage that server? And I think that's my question, is actually, because on the long run, of course, Lididki is going to hand it over to the country. And then it is for the country to decide on what they are going to do about it and ensure that that system actually works. Yeah, thanks.
Yes, thank you very much, Benga. About concrete steps you would like to take before the end of the year?
Sorry, I know this is a closed-out workshop, but do you have an exit meeting with the CVON before you leave?
Well, not today. But indeed, I mean, the plan, of course, as you see, we have worked on the recommendations, but there are still 8-page lists long, and we need to now, after all the discussions and so on, what are the priorities, the wording. Now we have the data to produce the short document needed by the policymakers. So we'll need to come back with executive summary of everything that's been done with Lididki and recommendation, and hand it over directly to the CVON, and from there probably would be the good moment to show the platform as well, and from there, hopefully, quickly move forward and for concrete steps. That's definitely the plan. I mean, we cannot just leave you like this. I mean, we want to be sure that we hand over the important messages directly to the CVO and the ministry. Yes. Any other points? Yes.
I think from the discussion, I think there's a lot of encouragement in terms of the things we have just discussed here. One thing is that as we talked more about data, it looks like there's a lot of data in Nigeria. What it needs to be done is to correct all that data. If there are so many NGOs doing work in the field on vaccination, and the government has been doing also vaccination, all this information needs to be corrected to start giving, even if it's past data, it can also give where are you coming from in terms of seroprevalence. Because if there must have been some seroprevalence studies done, and even from research and all that. So I think there is a lot of work which can help us progress and move ahead. And as we take on new results, like from this project and even other projects ongoing, then it will have a basis on which a lot of decisions can be made and even look at how the strategy for the country can actually be implemented. Thank you.
Coming back to this very important point of centralizing, collecting all the data already existing. As we were also mentioning, there's already mobility data existing from other efforts, and those ones should also be collecting everything done by universities. We know that there are a lot of universities, very good universities in Nigeria, also doing seroprevalence studies and collecting other important data that could be included, centralized to have already a better view of the situation here so that you can build on your strategy. You wanted to add something?
Okay, thank you. I can share some example from a Cameroon side because we realize that we have a lot of data and we need to centralize all this data. One thing under the CVO, for example, for us is yearly and not a monthly, but 6 months meeting calling by the CVO, and which all the stakeholders engage in one part of the control and eradication of PPR. The person involved in surveillance, the person involved in vaccination, the person involved in the research, for example, 6 months or 1 year, we evaluate all the activity, you put the data together, and you make sure that you align. Because when the country go to the mass vaccination, you have also one problem, the quality of the vaccine. And the vet service need to be sure that the vaccine is good and the vaccine have the certificate of PANVAC. Because in our country, for example, they have a many NGO, and when they came through the vet service, we oblige to buy the vaccine and to have a certificate of this vaccine before go to implementation of the activity in the field. And when you go to the mass vaccination, there are a lot of persons who come on board. And I think the simple or the monthly or the 6-month meeting under the CVO with all this topic can be the first step also to make sure that we align all the stakeholders regarding the control and eradication of the PPR. Thank you.
Very interesting suggestions as well. Thank you very much, Jean-Marc. And going back to this, one of our recommendations about the risk of counterfeit vaccine and to being sure to trace the vaccines used everywhere in Nigeria to be sure that they are the correct vaccines and they are well used as well. So thank you very much for this addition. Any last comments before we close the side events? I think there's been some quite interesting things that have been already said, and we can relay towards the Federal Ministry. Any other comment or suggestions at this stage? All right, thank you very much. I thank all our panel of discussion with us and everybody here. Thank you very much. You can see there is a will to go towards PPR control and eradication. We all want to go forward, and we are getting close to get the solutions and the concrete steps. And hopefully we will see you again soon with very good news. Bye. Yeah, it can be any good news. It can be we have
Okay, I've been directed to tell everyone that the meeting is now officially closed. Thank you everyone for coming.